Let me walk you through the endoscopic spine surgery. And the patient which we're going to operate, he is in 30s, and he presented with left lower extremity radicular pain, and he's tried everything, all the conservative treatment. So on MRI, as I'm showing that, so there is a left-sided herniated disc fragment which is causing the compression of the nerves, and that's the reason why he's having a severe radicular symptoms on the left side. And the next thing is I'm going to show you and describe the procedure on bone model. Okay. Let me explain the procedure on this model before we head to the OR. So this is a spine model, and as you can see, this is the front of the spine, this is the back of the spine, and the patient will be positioned on his belly, so his back is exposed towards us. And the surgery which you're going to do, as I said, I mean, it's a left-sided discectomy at L5S1 level, which is the lowermost level in the lumbar spine. And after the patient is on the belly, this is the right side and this is the left side. The idea is, with my working tube and endoscope, I'm going to dock my instruments here on the left side in this window. We call it the interlaminar window. And it's typically covered by a yellow ligament. They have not shown any ligament here, but they have shown it at a different level. Um, but it's typically covered by that ligamentum flavum. So the moment I actually visualize the ligamentum flavum, I'm kind of make an opening into the ligamentum flavum with endoscopic scissors, as I'm going to show you in the later part of the video. And once I entered into the canal, I'm going to identify this yellow structure, which is the thecal sac and the nerves. And I'm going to move this thing out of the way and expose the herniated disc fragment. As you can see, this yellow, this reddish structure, and remove it under direct visualization. All right, so now let's head to the OR. All right, this is how it's going to look inside the endoscope. And the first thing is, as I mentioned earlier, that I'm going to visualize and identify this yellow structure, which is ligamentum flavum. And I'm using this tiny scissor to make an opening through this ligament to expose the spinal canal, as you can see. Um, and I'm trying to widen this opening so that I have enough room to use my instruments. And this pulsatile structure which you are seeing, that's actually the nerves, and there's a layer of fatty tissue which I'm going to tease off with the instruments to expose the nerve and the disc. Um, as you can see now, I have exposed the nerve in the top portion of the screen is the nerve, and the bottom is the disc. And I'm using this our working tube to retract the nerve out of the way so that I can visualize the disc space. And the first step is to see if there's any opening in the disc, because if the disc fragment is herniated, that is possibly from some defect in the disc through which the disc fragment came out. And I think I found that spot from where the disc may have probably come out. There's a small hole. So disc is, as we saw on MRI, the disc is already outside. So the next step is to look for that disc fragment which is lying somewhere under that nerve. And we found one fragment under that nerve. I'm trying to grab it with this pituitary ronger. All right, the one fragment is out. And at this point, I have to keep looking because sometimes we can miss um, some disc fragments, hiding behind the nerve, and it can go either way to the lower part of the spine or upper part of the spine. So I'm using this, we call it a radiofrequency wand, to expose those hidden fragments. And occasionally, these fragments are kind of attached to surrounding soft tissue uh, because of this the scar formation. And the idea of using this radiofrequency wand is to slowly tease it off from the surrounding structure so that it is loose and safe for the removal. and as you can see now, it's clearly detached from underneath the nerve, and I'll remove this disc fragment as well. All right. And the final step is to, as we saw that opening defect through the disc space, and I'm using this radio frequency wand, which is essentially electrocautery, and which is coagulating this opening and inside the disc so that no there's the risk of the reherniation can be minimized. And this is the final decompression. The nerves appears to be very well decompressed, and all of it through a very small incision. And that's the beauty of the endoscopic spine surgery.